Hi, I'm Britt Carlson for Oroville Hospital. Today I'm joined by Dr. Ardavan Afrasiabi. Thanks for joining us today, Doctor.
Thank you for having me.
You're welcome. And today we're going to talk about strokes and, in general, the Stroke Center at Oroville Hospital. But first, I'd like to know a little bit about you. Your professional history, how long you've been at Oroville Hospital.
Okay, I'm an internal medicine physician. Went to school in Chicago and New York. I've been at Oroville for about 7 years. I'm the clinical director of the hospitalist program and the medical director of the stroke program.
So tell us a little bit about the stroke program here at Oroville Hospital.
Sure. We designed a stroke program basically to give the opportunity to the community to have treatment for stroke. Time is of great importance in treatment of stroke. Once the symptoms start, the clock starts ticking, and the quicker you can get to treatment, the better the outcomes are. So the coordination of the hospital with EMS and the community, as well as within the hospital, there's a team of stroke coordinators that help educate the staff and implement the policy so that it's streamlined. So when you have a symptom at home, the hospital is alerted and things are streamlined so that the diagnostic test can be done and the treatment can be given in a timely fashion.
Obviously, because time is the most important factor.
Time is very important.
And is Oroville a high-risk community for strokes?
Within a certain population, there's increased stroke. If you talk about prevention and stroke, you risk stratify people based on risk factors such as blood pressure, diabetes, previous history of stroke. Most strokes are first-time stroke. So out of the 800,000 strokes that happen per year in the United States, more than 3/4 of those strokes are first-time strokes. So it's important to risk stratify patients and really use preventative measures if you can.
And just, there is definitely an age range that you certainly become more at risk.
There is an increased incidence of stroke as you age. Over the age of 55, men have a higher incidence of stroke than women, and then it equalizes at about 75. Again, the risk factors are of great importance, and African Americans as well as Hispanics are at increased risk.
And what about symptoms that people should automatically see and know that that's when they should call 911?
Symptoms can range from subtle symptoms to very obvious symptoms. Obviously, if you become paralyzed in an arm or a leg and your face droops and you can't speak at all, you're probably having a stroke. You should alert the EMS and come to the hospital as soon as possible. There's also subtle symptoms of just not being as coordinated in your arm or leg. And this is a less of a devastating symptom, but this should be, a lot of attention should be drawn to this.
So family members maybe keep an eye on those more subtle symptoms and bring them into the hospital
Speech
anyways.
problems, even confusion, if you notice any kind of drooping in your in the family member's face. The person having a stroke often may not realize what's happening. And so it is a third party that observes the change and brings attention to that person.
So do you think that the Stroke Center has made a real difference in really expediting the patient to where they need to be and getting them the help that they need?
Absolutely, absolutely. This community has become much more aware of the symptoms of stroke. Our data does suggest that we have treated more strokes successfully in a very timely fashion. Our outcomes are much better. We received a gold award from the American Heart Association. And this is basically them reviewing the data as a stroke center, and they have very strict criteria that they look at, and they grade you accordingly.
Now, if patients or their family members do want to contact the Stroke Center and get more information, if they have a concern or they're concerned about a family member, how could they reach you?
Sure, they can call the hospital at 530-533-8500, or they can ask their doctors about stroke.
Well, thank you so much for all the information today, Dr. Afrasiabi. Thanks for joining us.